In the previous video, when I was talking about my first experience in nursing clinical assessment, I told you guys that I was going to create a video on how to pass your clinical assessments, and yeah, so we'll be doing that today. And remember guys, that for clinical assessments, most people maybe usually think that you'll only be doing exams like after classes, but then there's something else that we do, that every time after you're done with a certain placement, you're usually required to do a certain exam, which are the assessments that I'm going to talk about today. So how do we get to pass these clinical assessments? Welcome back, beautiful people. If you're new here, my name is Lesodora, and so in this channel I talk about nursing and also do lifestyle vlogs. So if that is something you're interested in, you should consider subscribing. So I'll be talking in terms of like different parts. I'll start by talking what you'll do like during clinicals, what you'll do during your study time at home, and also what you'll do like days before the assessment comes. So when we start with the clinicals, the first thing is that you should be ready to learn. Like, no one is going to force you to learn. Like, just make yourself ready to learn. When you come for clinicals, come with a notebook, that when you hear something that you've never heard before, you can write it down. Then you go back home, you can search about it, and don't just have the notebook. Like, I've seen most of us actually having a notebook. You write all these things, but when you go home, you don't even open it. You look for it the next day in the lab coat. Like, you even leave the lab coat in the hospital with the notebook inside. Then tomorrow you come again, fill it with other notes, but you never get to use it. So be ready to learn, ask questions. Like, if you don't get something, the nurses are there. Just ask questions, and also like try out like things that participate in things that are happening. That if you see a nurse doing something, you can go there and check how they're doing it, and then ask them if you can try out on the next time you get such a condition, you can try doing the same thing. So like, participate in these things. I told you guys when I started talking about placements that we have nurses who will never ask you to participate in anything unless you ask them yourself. Like, you'll spend the entire time with them without doing anything. And remember, you're not only going to be a student forever. One day you'll be an employed nurse, and who would like to employ a nurse who has never done anything in any procedure? So just make sure that you learn these procedures for the little amount of time. Maybe it's only 2 months. Make sure you learn these things, because at times you might be told you go like somewhere in another hospital to insert an IV or a catheter, and you find that you've never done it before. Because I know at times you get scared. Me personally, I used to get scared because like I can't take the fact that I've never done something and I want to do it. Like, it scares me a lot, because for us, we didn't do a lot of skills lab, so we don't know most of these things. We are doing them with the real patient first hand, like we've never done it on any dummy or something. So just make sure you push yourself to try and do it, so that even when you become a nurse one day, like, you already know what you're doing. And then the other thing about trying out is that on the next time that you'll be doing the assessment, you'll feel comfortable, because when you're told to do a certain procedure, this is a procedure that you've ever done before. It is something that you do every time you're on a shift. So that means even if the lecturer tells you you're going to do this procedure like for your assessment, it is something that you've done before, so you find it so easy to do. But if you've never done it, like you are doing it for the first time during the assessment, it's going to be so hard for you. So make it a routine to try and do some of these things. And then the other thing is, be a student. Take your time to be a student. Like, let 80% of that time you're there to be being a student. Because let me tell you something, when you get there, especially in your first year, these nurses and the staff, they like taking advantage of students. Let me not lie to you. Like, when students come, they usually feel like it's time to rest, and the students usually do most of the work. So you find even the casual workers, like for us in Muraga, you find that the casual workers are the ones who used to go like order stuff. Like, you know, at times in a ward you need normal saline, you need syringes, so they used to go and order those things. When students come, they don't do that job anymore. Like, that is the work for the students. They just wash and then sit on the sun and bask, and then the students will do the remaining work. So I remember when we started out in our first year, they used to do like the job allocation. So they allocate you a certain job. So I remember in that job allocation, there used to be something called stores. Imagine you went for an attachment, you have an assessment, but then someone puts you in stores, that the whole time on your morning shift, where kazi yako ni store. So I remember we used to go to the stores, and then una order hizo normal saline nini jig. So you're there, you're carrying boxes and jigs and jerry cans, like. So I remember there's this time a certain lecturer came, and he was saying, like, you students, amko serious, kazi tu ni kuenda store kubebana na mabox kwa kichwa kama mama wa soko, na kutana na nyinyi huku kwa corridors, mko na box kwa kichwa, vitungi kwa mikono, mnakaa ni kana kwamba hiyo ndio kazi mlikuja kufanya hapa. Mlikuja hapa kubebana na box na vibuyu, and it used to be so embarrassing. That day, like, he opened our eyes. Like, kazi yetu ni kubeba box. Ukishabeba box, ukuje uweke kwa ward, uweke normal salad, upange vizuri kwa kabati, unaenda kwa corridor, unaruka kwa chuma kama monkey. Hiyo ndio kazi unafanya tu ku clinicals. Assessment kifika, you have no idea of what you're doing, you see. So from that day, I think we started refusing that store. That is not our job. Going for, if the nurse does not go to stores, then why should a nursing student do that? So from that day, we started refusing, like, store is not a duty. Like, they should not stop doing duty allocation at store. Until now, the whole day we kazi yako ni store, as if there's store in exams. Really. And then when you go for clinicals, have your supplies, have your pen, your notebook, like, just have these things. Although you might be seeing me putting on my stethoscope, but mostly for, like, most of the public hospitals, nurses don't use the stethoscope. I don't know, it's because we have clinical officers who do most of the things with this. Like, I don't know why, but I've only seen it in some private hospitals, nurses using it. But let me not lie to you, even when you go for, like, attachments, you'll never see any nurse using it, and you'll never be asked to use it. I remember this time I was told to set a trolley, and I was told that nurses don't use stethoscope, remove it from that trolley. So yeah, you won't use it. Then the last thing about clinicals is, don't just sit down and, like, be cadexing. Like, I've seen so many students who, whenever they come in the morning, they say that their job allocation is just cadexing. And you know, like, cadexing for Kenya is just weird. Like, people write the weirdest thing. Like, even the patient hasn't taken lunch, but people are writing, oh, woke up in, like, well, found in a very fair good condition. In fact, the FGC patient received patient in FGC, breakfast taken, medication given, ward round, and then lunch served. That is, so you can imagine, if that is the only thing you went to do the time you went for clinicals, you can just imagine how much you are really wasting it. Because sitting down and cadexing, and then we have another group of people going around for ward rounds, writing things, studying. You can't expect to be the same kind of student by the end of the day. So to be able to do well in your assessments, make sure that you not only just be a student who wants to sit down and cadex, like, go for ward rounds, listen to what they're saying about a certain condition, write it down, go research about it, go, like, because this is, when you're doing your clinicals, you're also revising for your main exams. Because when you read about the condition and you talk about it and you discuss it, it's something that you'll never forget, and that means when it comes in exam, you'll do well in it. So go for ward rounds, ask questions whenever, like, you see doctors discussing. Like, if it is not something that is private and other nurses are there, you can just go and listen to it. But don't be that kirere so much that everywhere you just want doc, could you call it a dog? I usually see some students that are just so annoying. And then the other thing is about now the study time, during your study time. So you took that notebook, you wrote some conditions. Go and do, like, research on those conditions during your study time, and just do one thing at a time. Like, don't go do hypertension, diabetes, anemia, everything. Like, do it at one time. Make sure that even today you say you're doing hypertension, do everything about hypertension, do the medications, do the antihypertensives so well. Make sure that you have, like, really mastered everything, the mnemonics, the whatever, like, you know it so well, so that, like, by the time you do diabetes, like, you won't forget about hypertension. Because if you combine them so much, like, it gets so hard for you to be able to, like, study them. And then another thing, when you go to study, make sure that you can review the procedures so well, because most of these nurses, the procedures they're doing are just shortcuts. Like, they're shortcuts, they're things that if you are doing your assessments and they see you doing it that way, like, it is wrong. Like, they do shortcuts. So another thing about reading the procedures is that you can be able to be a nurse who does the, like, correct thing, even apart from assessments. That apart from you just doing well in exams, you are able to be a nurse who does the right procedure. Right procedure is always just, like, the correct thing. You won't mess up by doing the right procedure. So let's say today you inserted an IV with a nurse. Go back and see the procedures in the procedure book, and just see how it is done the correct way, so that during assessment you don't do it the wrong way, and so that at least you can have the idea of how things are done the right way. Like, you should just stop normalizing that doing shortcuts is the right way. And then, if let's say maybe you are studying a certain patient, maybe the patient had hypertension, just do the entire thing about hypertension, the management, the the symptoms that they present with, the medications, like do the entire thing about like hypertension, and then you can just like write it down, and every time you have that book and you read about it, like you cover medical surgical nursing, you cover pharmacology at the same time, and you're just covering a big part of the nursing thing. And then something else that is something that I really used to be part of: stop taking pictures of those charts and then keeping them. Like, taking pictures, people usually love it. That we've seen a chart about malaria management, we've seen a chart about hypertension, we've seen a chart about everyone is busy taking pictures, but then no one looks at those pictures. Like, I'm a victim. Like, I have so many photos that I took of the charts that are on the wall inside the ward. At times we usually take it only because at times the nurse comes, these charts are the ones that you're going to be asked in your assessment, because the lecturer at times comes with no question, but then atangalia viju, and then they see something in that chart, and then they'll ask you that question from there. So make sure you take those pictures. So we used to take pictures because of that. At the times we never used to look at it. So make sure you look at those charts, that when you take the pictures you look at them, because sometimes the questions are going to come from there, because these are management of things that are in that ward. So most of the time questions are going to come from those charts. So take those pictures, but then go and like look at them. Like, yeah, but let's just look at this. And then when it comes lastly 2 days before the assessment, like go through that assessment book. Like, they usually write down where the marks are going to come from. Like, the way you are dressed, I don't know, 1 mark. The way you understand about this condition, 1 mark. Indications of the drug, 1 mark. So like, you've already been given already have an idea of what is going to be asked. So this should make it easier for you. Take that book. Like, I think I'm going to make a video on like how to analyze and like how to get to answer. Like, you already sit down and try and answer those, ask yourself questions and answer them just from what is that in that assessment book. I think I'm going to make a video on how to answer that, I think, so that you can get what I'm saying. Like, go sit down with that book, try and ask yourself questions that you think is going to go from that thing, and then try and answer it, so that at least by the time they're asking you, it's not like you didn't even have that book in the first place. So just know how to answer. And then days before, also research about the common conditions in that ward, that even before you choose a patient, you already know in this ward we mostly have gastroenteritis, and we mostly have like pneumonia. So you go read about pneumonia, like you have an idea about all the conditions that are going on through in that ward, because at times you might have chosen a patient with GE, but when the lecturer comes, they ask you questions about pneumonia, because apart from that patient of yours of GE, you should have an idea about what other patients are going through in this ward. So that is why I'm telling you, try and also read about the other conditions that are going on in that ward, and then like the management, the entire thing that I say, just try and read about the conditions in that ward. And then also days before, for us, they used to tell us to arrange the ward, make sure you name everything, make sure everything is in order, because there's some things that can take your marks. I think when we're doing management, for the management assessment, I think I should just try and cover these assessments individually, like management individually, nursing care individually, pregnant women individually, so that you can get it. Like, I remember for management, like there's this student whom the lecturer just passed through the bins, and then she found, I don't know, someone placed papers in the yellow bin and then gloves with blood in the black bin, and that messed everything for him. So just make sure the ward is in order. Tell all those COs and doctors that today we have an assessment, make sure you do things the correct way, because at times you've arranged everything, but then because they don't know, they end up like throwing, because at times people who are used to there, they don't care about disposal like in the right bin, or like arranging things and syringes in the right order. So you can just talk to them before that. So yeah, that's it. So make sure you just be a good student, but don't let people take advantage of you being a good student, because at times you become so good, people take advantage of that. So be a good student, but also let no one take advantage of that. So yeah, that's the video for today. See you on my next video.